I'm here for another segment and I have a smile on my face. I'm here for the Kentucky One Health, Living Well with Kentucky One Health. We're going to be talking about joint replacements, and there's some new innovative surgeries going on. But first, I want to introduce you to two outstanding surgeons. I want to introduce you to Dr. Stymack and Dr. Malconey, and welcome to Urban Lifestyles. Dr. Stymack or Dr. Malconey, I'll let you do the intros. Tell me about the exact office and the practice that we're in.
So we're in the Shea Orthopedic Group, part of Kentucky One Health and a Jewish hospital specifically. And our group has basically been around here for several years, and we do a lot of sports medicine, trauma, hip and knee replacements, but mainly we take care of patients in the greater Louisville area. And we're delighted we could introduce our group and our program that we have here, which is a tremendous opportunity to highlight our total joint program in Louisville, Kentucky.
Okay, now Dr. Stymack, I understand Dr. Malconey just made mention about you being familiar with the equipment that we're going to talk about from New York City.
Correct. Yeah, I was doing my fellowship in hip and knee replacements up in New York a couple of years ago, and had exposure to the Stryker Mako robot up there.
Now, when it comes to joint replacements, I can just think about what has been the traditional practice, but this is a robotic procedure. Share with us the difference between the two.
Sure. So first of all, joint replacements has exploded in America over the past decade. Most of now patients living in the 80s and 90s. There's been an increase in what we call octogenarians, of patients in the age of 80. They've doubled in number of joint replacements they're getting over the past decade. So there's been a huge, people living longer. They're getting younger patients are getting hip replacements, knee replacements. Senior citizens are getting them. So there's a huge volume. So it boils down to we want to make these parts last a long time. And so these parts now that are made are quite durable. They're made from amazing technology, almost 3D technology, some of them are. So we have equipment that's high tech, but we still have human hands putting the parts in. So the next evolution of joint replacements has been to have sort of robotic technology that helps us put the parts in. We think we're pretty good surgeons, but the robot makes us better. So this is something that has been introduced now in North America for just a few years, and we're lucky to have it. We're the only hospital in Kentucky that has one now, and it's robotic joint replacement. It helps us do hip replacements. It gives us real-time information and basically what size the patient needs, where it needs to go, what the leg lengths are in surgery. So it helps us become better surgeons, basically.
Okay, so you mentioned about making sure that these part replacements, if you will, in the joints can last. I've always heard that if a patient gets a hip or a knee replacement, it's going to last about 7 years. Is that true?
No, I can tell you that the data shows that almost 96% of patients have it for almost 12 to 15 years. But there are some patients, I have a few people that gain a lot of weight, and unfortunately in Kentucky we can gain a lot of weight in this state, and they can wear some parts out. But most parts should last you a long, long time. Because their parts are different than the one we put in 10 years ago. The bearing surface is different, the metals are different, they're made to be more durable. Just like your phone is so much better now than it was 10 years ago, technology has caught up with implants. So we have implants that are tremendous in patients. I can tell you some of my younger patients, they can go for years. I've got people 18 years, 20 years doing well with the implants.
Okay, because I was always wondering if you're a person in your 50s, 45, and if you only had 7 years, wow, that meant going at it all over again. So then, Dr. Stymack, tell me, and are you familiar with the traditional procedures of joint replacements versus now this robotic?
Absolutely. I mean, that's how we both trained as traditional hip and knee replacements, and so, we just saw the benefit of the robotic surgery, and we've added it to our repertoire already.
And what are some of the benefits? I'm going to say first to the surgeon and then to the patient. I'm going to start with you, Dr. Malconey.
The benefit of the robot? Well, so first of all, in surgery, we have to determine what size the patient is. We all come in different shapes and sizes. Our sockets have different alignments to them, so we have to reproduce what the patient's anatomy is. And so it's a little bit of trial and error in surgery, what size fits the patient best. And so sometimes, we're good, but sometimes it may not work out just perfectly right for that socket or the positioning of the implant or the leg length. So with the robotic technology, before the surgery even starts, we know what size we need. We know where to put the parts in, and as we're putting the parts in, if we're a bit off, the robot kicks us into the right spot. And so it's really, makes things perfect for us. It just gives a lot more confidence that we're doing the best possible technique for our patients. We're going to give them the best possible results, and that'll give them the best outcome. And with the robot, you don't have to make big incisions. You don't have to do huge exposure, and so the patients have less pain. They bounce back faster, and so we think this is going to be really beneficial to our patients.
Wow, that's interesting. So then, Dr. Steinmack, what would be some of the challenges? Because I know everything has to come with a challenge.
Sure. As a surgeon, there's a learning curve. Anytime you adopt something new, you have to learn how to do the procedure. It adds a little bit of time to our typical OR cases. But right now, I think both of us have really gotten it down, even just within a couple of months, where we're just as efficient as we were beforehand. Beyond the learning curve for us, I don't think it really changes anything in hip and knee replacement, other than improving the longevity of the implants for the patient.
Being a little modest, his patients, if the hip replacements are going home the next day, and they can walk with a cane within a week or so. So they're doing quite well. I'll let him explain about his patient outcomes thus far. Pretty impressive.
I do what's called an anterior approach hip replacement, and I've added on to that the Mako robot, which nobody else in the state's doing, and so it's certainly getting patients out of the hospital faster. I would say roughly half of my patients go home the next morning, and the other half will go home probably the day after that, and they're getting off of walkers faster, getting off of canes faster, going up and down stairs faster, and I think having the implants in the correct position is going to help prevent things like their legs being a different length, and the robot will actually tell us in surgery that the legs are exactly the same length, versus the old way, you don't know that until afterwards. And it also helps us know that the cup or the socket's in the exact position we want it to be in. And that's going to help prevent any possible complications such as dislocations where the ball actually pops out of the socket. And so all that's really beneficial for the patient long term.
So since you both have mentioned about ensuring that this, the implant product itself is correctly placed, does that mean that correctly placed is matching the other natural hip or leg, or it's matching to where you are in this particular joint area? Because I've heard of, put a pin in it, because I've heard of certain patients saying, my new knee or hip is replaced, but it's not matching my old.
Yeah, so basically we're trying to reproduce the patient's anatomy. Most patients, almost 95% of patients have arthritis. If nothing's wrong with their socket, most 90% of patients who have arthritis, there is nothing wrong with their socket or their thigh development. So there's no deformity. So you're just trying to reproduce where they are in space. But that allows us to balance the muscles, that allows us to get the leg as close as we can. So we never had real-time information or numbers. There's no numbers. We're kind of looking at the patient's landmark and guiding our parts. Now we have actual numbers and angles that we can use. So it's really pretty neat, and I think once our patients realize what an advance this is in technology, who does not want to have their parts put in the best possible position for themselves?
Exactly, and once you mentioned about they could pop out. So last question then, I guess. Who is the correct candidate for this? I mean, how long do you have to wait versus you have arthritis and maybe you have bone on bone, or you don't have bone on bone, or you don't have, is it because you have a lot of pain? Who's the best candidate?
Okay. Yeah. It's people who've had pain usually for longer periods of time, people who have tried conservative things like activity modifications, weight loss, they've taken anti-inflammatory medications, done physical therapy, maybe had an injection. And when all that fails and it's really interfering with your quality of life, your ability to work, to sleep at night, those are the people who are going to benefit the most from having their joint replaced.
Would you ever do 2 hips at the same time or 2 knees at the same time with this procedure, robotic procedure?
You can. It just depends on the health of the patient. Yeah, most patients with hip arthritis, the surgery is the very last option. It's the last option, and basically most of my patients who need hip replacements, they have a hard time putting their shoes and socks on, hard to get out of a car. And with knees, they basically have a hard time walking. They limp quite a bit. So if all the non-operative things have failed, then basically you're a candidate for surgery, and now we have parts and equipment to ensure success of these implants.
Astounding. I appreciate the technology. I have to say again, Kentucky One Health is always the first one to have the innovation with technology and for our medical health care. So what information are patients are looking out there and saying, oh yeah, I've been putting this off. How can they contact this office, and what should they do?
Yeah, I mean, if you go on the internet, obviously, and look for Kentucky One Health, you'll find information about our practice under the orthopedics section, or they can obviously call our office.
Well, it's a very innovative procedure. I remember having a torn meniscus a couple of years ago and going through that. And it seems like everybody that I know today is having either one or two knee surgeries.
And hip replacements
Right,
are big too, because Americans are, as adults, we're living longer, or let's say worldwide, and you're going to need a hip or a knee. Now, what's really good is now you don't have to get a whole knee replacement. That partial knee replacement is really neat too. And all this is done robotically. So they have the precision to line things up so you don't have to worry about the artificial joint pumping out of your
Ouch.
your hip socket.
Okay.
And you want your knees to be lined up, because if you're standing and walking, if they haven't been lined up, that's not good. But with this robotic method, it's on point.
All right, well, that's some more great information for Kentucky One Health. We'll take a quick break and back with more right after this.